Hi, it's Dr. Michael Ellis. I'm happy to be here today and to be able to share some information with you. I'm a child psychiatrist and also a parent of a child with autism. Her name is Gabrielle, or goes by Gabby. And basically, I wanted to discuss, and the leaders of the group wanted me to discuss autism and puberty, which I'm happy to do. I probably will also discuss some other things that I think is probably important for you to know surrounding autism and puberty. But basically, I have a 15-year-old daughter with autism, and so I'm kind of well versed personally and professionally on kind of how difficult puberty can be. I treat mostly autism in my clinic in Columbus, Georgia, and so have become an expert in dealing with autism pretty much at all ages. So I think the first thing that's important to know is that all parents are kind of terrified of their children hitting puberty and going into puberty. Number one, it's normal for parents of typical children to have a hard time dealing with that with their children going into puberty. There's a huge difference between looking at your child like they're your baby or your young child to looking at them like they're soon to be an adult. And so it's tough. It's tough for the parent, it's tough for the kid. And so we're going to discuss some specifics about puberty and some of the unique things that parents of children with autism have to go through, and of course looking at it from the child's perspective, things that they themselves have to go through, that some of which are not surprising, and then maybe other things that are surprising. So the important thing to know is that everybody goes through puberty and about the same time. It doesn't matter if they have autism or not, or a developmental disorder, they're going to go through puberty. You can't slow it down, you can't stop it. There's nothing that you can do about that. I know I have a lot of parents of patients that I treat that wish that they could, especially if their girls kind of slow down, adolescence and delay the onset of their menstrual cycle, but it just doesn't really work that way. Usually puberty in girls happens around 12 and boys around 14, so those are kind of the ages that you should be looking at. Of course, sometimes they start to have more mood changes or more irritability or grumpiness a little bit before that, like maybe a year before that, but that is a big deal to kind of keep in mind when you kind of expect for some of the physical changes and even the mental changes to maybe start to take place. So some examples of potential challenges for a teen with autism is a difficulty following complex school routines, which we're going to get into a little bit about school. Rebellious demeanor at home and sometimes even at school. If you're lucky, it may just be at home. They're unable to make friends because of multiple issues, whether it's relating to peers, having a difficult time, kind of with nuances in relationships. And then also just because of hygiene being an issue. It's very difficult, as you know, if you are a parent of a child with autism who's a teenager, it's difficult to kind of keep after them, to bathe and brush their hair and do all those hygiene things that maybe other people may take for granted. It's not always common sense. They don't always see the need to, or maybe sometimes it's a sensory issue and they just don't want to. Of course, in puberty, they have a difficult time typically understanding romantic and sexual feelings. So that ends up being an issue that we're going to discuss a little bit more later as well. Of course, many times to fit in, kids on the autism spectrum may feel more pressure to fit in. And so that ends up being something that parents have to deal with as well. Because of their social and verbal limitations relative to typical peers, autistic teens may not respond appropriately, as we all know, even at younger ages. Only talk about a specific interest, and that may cause their fellow peers to kind of get annoyed with them or want to have less to do with them because they know that Jacob is only going to talk about trains or a particular video game or something like that. They may not respond appropriately to jokes or sarcasm, which I'm sure all of you are aware of that. But that becomes a problem when dealing with their peers. You as their parents may be comfortable and understand it, and it's the part of the cute things that they do, but Other peers may not feel the same way. Talking in a formal business-like tone, which sometimes can come into an advantage, and then other times actually be a big problem, because they may sound too grown up maybe for their peers, and their peers may not like that. But all these things that I just discussed, they sound like they may be subtle in some cases, but really those, especially gaps in communication and relationships, can really hurt a peer's social life at the time when they may themselves also very much want a social life. But I think it's important to know that those on the autism spectrum are a very wide spectrum. We can't, it's hard to generalize to a huge degree, meaning that obviously if your child is nonverbal, some of what I just said isn't even going to apply because they may not be able to talk with peers at all. However, they may still want to play around peers. They may still want some sort of social aspects. And so it's important to be aware of that, that they may start to crave more attention but not know how to get that attention appropriately from their peers. So they may do things that are inappropriate really to get attention, and it's not necessarily that they don't want to have friends. They do, they just don't know how to go about it. So please be aware of that. I mentioned their hygiene. So a lot of times those on the autism spectrum don't really see the importance or why they should have to keep their body clean. Their hair looks fine to them. They don't really seem to notice it. They don't feel dirty necessarily. So you may have to really prompt them a lot to bathe and explain over and over why they need to. Maybe even being very specific and concrete, not being rude, but very specific, like, well, you start to smell if you don't take a shower, so that they really understand specifically, concretely, why they need to take a shower, not just because everybody does, but actually a reason. They also may have body awareness issues where even when they do take a shower, they may neglect a whole side of their head when they're taking a shower, or a whole arm or a body part, or they might just go like this real quickly, but they're not actually washing themselves very well. So that really is neurological. I mean, it takes them some time to really be aware of their body enough to be able to do that, and it takes a lot of practice. Also, helping them develop consistent strategies and a consistent hygiene routine is really important. Parents really do need to help them with this. It's not going to come naturally, typically. You're going to have to come up with some sort of routine or a checklist when they're taking a shower so they know what to do first. Then the other thing that I want to talk about is obviously them changing bodies. I mean, obviously we all know that during puberty, people's bodies change, but we can't take for granted the fact that they may not know how it's going to change. You have to really give them a heads up on this. You can't just wait till their body starts changing to start talking to them about it. There are some books out there. There's some resources on Autism Speaks, but in fact, there's an Autism Speaks puberty guide. But I encourage you, probably even more so with females, but really with males and females, to kind of give them a heads up on what's going to start changing of their bodies, so that they're not frightened, they're not scared, they're not confused, they're not anxious about it. So they're really having a long time, like a year or more, maybe 2 years, to kind of prepare for those changes. So when boys hit puberty, their voice lowers in pitch, and that again may be a problem for them because that's a big change. Their penis may grow longer. That may be kind of strange to them. When girls reach puberty, of course, their breasts grow larger, menstruation starts. And girls, obviously, most of the parents of girls that I treat are very, very, very anxious, including myself with my own daughter, about the first menstrual cycle and how that's going to go. People are almost paranoid about how that's going to go. And there have been some research articles that have shown that actually, usually it goes far better than anyone expected. Most people, it goes by pretty smoothly. But I would encourage you to talk to your daughters about what to expect and how to proceed once that first cycle does hit. You can also buy obviously hygiene products and show them before they ever have to use them. You could use something called period panties, which really helps with those that are really scared of the the texture changes or the wetness that they may feel down there that they may not be able to tolerate. And those sorts of things can help quite a bit. But since you know your child best, you're going to know possibly what kind of sensory issues that they may have around that time. And then as far as sexuality goes, a teenager may start feeling attracted to members of the opposite sex or the same sex. They may develop these urges, and parents are often not ready for that. Of course, it's very unpredictable to know exactly what age those things are going to happen. People that have autism spectrum disorder and intellectual disability, which are many, certainly it's going to be a little bit more unpredictable as far as when those things may happen, but you cannot think that your child's going to be innocent, so to speak, forever, and that they're never going to have any of those thoughts, even if they have intellectual disability. And that is what kind of an old myth has been, that has been dispelled by research, that that people are not asexual. They are sexual, and so at some point, usually around puberty, but maybe a little delayed, they are going to start to develop those urges, and sometimes not know what to do with them and not understand them. And so unfortunately, even though it's very uncomfortable for parents to discuss, you're probably going to have to discuss it, or at least have a therapist discuss some of those issues with them under your guidance. Some of the most important things to talk about is masturbation, and it's a topic that almost everybody is uncomfortable talking about, unfortunately. But of course, it's reasonable why it would be, especially since you're talking about your child. But especially with males, it's very important to tell them where the appropriate place to do that is. It's normal if they do, and it's normal if they don't participate in that activity. But the important thing, no matter what, is not the act itself, but where it's being done. So you have to really teach them that they are not allowed to expose themselves in public. You have to tell them to not let people touch them or their private parts, and to not join any group to participate in anything sexual. Whether or not it's uncomfortable for you, you have to discuss those things. Most parents, of course, will tell their child that if they're going to participate in that or masturbate, that they're absolutely going to have to do that in their bedroom or in their bathroom or the shower or something like that. And I can't stress enough how important that is. And I think that some of you that are listening that have children, especially males on the spectrum, it can be a huge issue if they are touching themselves in the classroom, even innocently, not even knowing really what they're doing. It can be a big issue. So please teach them where it's appropriate to do that. Don't yell at them. Don't slap their hand. Don't do any of that, because it's not going to work. It's going to be a losing battle anyway. Just tell them where it's appropriate to do that, because you won't be able to stop it. So talking a little bit more before we get into the sexual feelings and stuff that people have, I wanted to discuss briefly school challenges that people have, because the school challenges, everybody knows that children with autism can struggle in school, and we all know that for sure. But most people feel like once they have started school, elementary school, and they've been doing pretty well in first, second, third, fourth, and fifth, if they've been doing well, they're pretty much out of the woods. But unfortunately, that's just not really true. And again, I really wish that it was true, but you have to think about the fact that when in middle school, there are a lot more challenges around the age of puberty. There are more challenges that present themselves, both cognitively and socially. So for those on the spectrum, school can be more difficult. So even if your child is in mainstream classes, his or her teachers will often ask more abstract thinking questions and expect assignments that can't just be memorized. Most of our children on the spectrum can be amazing with memorization, and I'm sure most of you know that already. They're great with fantastic recall, maybe even better than typical children in many cases. But abstract reasoning and abstract concepts can be more difficult for some. And so they may start to fall more behind in school than you expected. So just be aware of that. And obviously when that happens, or if that happens, that can really damage their self-esteem, especially if they were used to, achieving at a higher level. Their grades may drop a little. So you also, if their self-esteem starts to drop as a result of school, then getting lower grades, then of course I encourage you to talk with the child's therapist or talk with your own child yourself and discuss specifically maybe what are some things that we can do to help raise the child's self-esteem so that they can realize that they're really good at all these other things, whether that's sports or whether that's drawing, coloring, music, playing the piano, anything that you feel like they can excel at to raise their self-esteem. That's going to be really important because, as we all know, school is not everything by any stretch. There's way more to life than that, and they deserve to feel good about themselves and find their gifts and their talents. The other thing that I wanted to make sure that I touched on more was more in depth about sexuality, and then also want to talk about aggression and some other mental illness type things that can happen more specifically to those on the autism spectrum. So it's important to know that teenagers on the autism spectrum, again, develop normally sexually, and they have romantic feelings just like any other child of their age does. But it's also important to remember that sexuality is not just sex. It's more about how the child perceives their body and feels about themselves, and how he or she understands intimacy with another person, and receives and gives affection to other people. So it's very important to understand that it's not just about sex. It's about human relationships altogether. And so navigating the teenage years for someone with autism can be very tough. And that's especially true because many people with autism, they're very specific in how they want to be touched, or they don't want to be touched at all. And so it's important for them to be able to interact with someone that they're interested in whatever way they can. So helping them to do that is going to be essential. Basically, children on the autism spectrum can still explore at a young age sexually, just like those typical children will. So you can't not expect that to happen. The important thing, especially for parents of girls, but also for any parent, is to make sure that they really understand about consent and safety, meaning that you want to make sure that no one is taking advantage of them in any way, and talk about good touch and bad touch and what's appropriate for other people to do and what is not, who's able to see you naked and who is not. Those sorts of things are really important. And consent, of course, means that your child needs to be sure that he or she feels okay with whatever kind of sexual experimentation that person and or your child and the other person is doing. And I know most of you are saying, well, I hope that just not at all. But again, that's not realistic. And of course, it all depends upon where your child is at, both mentally and physically at that period of time. But it's important to understand that even if you can extrapolate not during teenage years, as far as what I'm saying, extrapolate it to adulthood, because it's still the same in terms of sexuality. So your child may also not even understand when someone is attracted to them and when they're not. They may misperceive cues. And when they misperceive cues, that could be a big issue. They may think someone likes them when they really don't. They may start to become, quote, obsessed with someone else, which may really be more so related to like a circumscribed interest. And so social stories can really help your child understand, how do I know when someone's interested in me? How do I know when someone wants to be my boyfriend or girlfriend? How do I know that? And so you can help them with that. And if your child has an ABA therapist, I'm sure that they can help them with that as well. Again, as I said, sensory issues and those with autism continue to be a big issue throughout their life on some level. The end of a relationship is typically what I really end up having to focus on as a psychiatrist, because I see people that break up with their boyfriends or girlfriends all the time, and a lot of times that turns into depression or even suicidal thoughts, God forbid, and that's it's a terrifying feeling. And a lot of these people that do have autism spectrum, they feel so close to this particular person, or closer than they've ever felt to anyone. And it's a great loss. They don't feel like they can just go find someone else to be their boyfriend or girlfriend. And so it's important to understand that an end of a relationship for someone with autism may be felt more severely than it is for the average person, although certainly you can argue that for the average person it's felt pretty strongly as well. So some things you can do to support your child is, number one, understand that this is a serious thing. This isn't just a small minor issue. And if you don't understand that, then you're going to miss signs that may indicate that they're really in trouble, like such as having suicidal thoughts, or that they're really depressed. They're not just heartbroken, they're having major depression. So you can support your child by spending more time with them, encouraging them to spend more time with family and friends, doing things that the child enjoys with you. Talk about what happened. Try to talk about their feelings if they will talk about it. Express how the child can express how they're feeling in their diary or in social stories or something like that to get that out. And of course, as always, which I'm going to discuss a little later, if your child becomes clinically depressed, obviously you should seek professional help in an individual counselor. When I say counselor, I mean master's level social worker, or which is a clinical social worker, or a psychologist or something like that. Hopefully your child will have already had one, and so it won't be so difficult to set that up. But if that happens, then you at least will know what you need to do to set that up. So it's important to express and let your child know about personal boundaries. And when I say personal boundaries, I'm not just talking about how they act sexually, but when is it appropriate to act in certain ways? When is it appropriate to touch someone at all in any way? And when is it not? And especially in the school setting, that's really taken very, very seriously. So definitely we want you to understand that, so that we can kind of prevent your child from getting into trouble that we don't want them to get into. So as far as, and let me say this too, I also want to say that I'll be happy to answer questions even while I'm talking. I have some specific things that I wanted to talk about, but feel free to ask questions anytime. I'm looking at my phone right now to see if there is anything in particular. But I think it's important for you to know that I'm happy to answer any questions that you have. So the next thing that I want to talk about is aggression. Let me say this too. I also want to say that I'll be happy to answer. So basically, I know that that many times, unfortunately, people have aggression, even throughout their life, meaning even 3, 4, 5, 6 years old and up. And sometimes I have had some patients where they are not having any significant aggression or agitation until puberty, which is a little bit unusual, because most people think that they're kind of out of the woods in terms of their child being aggressive. If they haven't been significantly aggressive or had, hit anyone or been throwing a lot of things or having really major tantrums by puberty, they think they're kind of out of the woods, but that's not necessarily true. Sometimes people can start to have more problems around that age, but there's also a lot of variability. I've seen some teenagers where they start to be able to regulate their emotions better by their teenage years, and it goes the opposite way, where they actually have less aggression and less irritability. But it's important to know that puberty is a time of many changes, not just physically, but mentally, and also behaviorally. Their behaviors may change, hopefully for the better, but it could also be for the worse, and I think we always have to prepare for that. And I wanted you to know that specifically, most people perceive that the times that someone becomes aggressive is typically because they're having difficulty understanding what's going on around them. They can't communicate their own wants or their own needs. They're anxious and tense, dealing with a lot. They may be having sensory sensitivities or just be completely on information overload. And we want to escape from stressful situations or activities. So a lot of you probably already know this. I mean, actually, one thing that I love about autism parents is that they usually know way more than is expected for them to know. And I think it's a great thing, but it's also kind of unfortunate because it means that you've had to learn a lot of things on your own to be able to do what you need to do for your children. Um, it's unfortunate that you have to, but it's amazing how resourceful you all are and trying to figure things out even on your own. But basically, what is very important about the aggression part of it is it can't be minimized. I know that most of you that have children with aggression are scared about what is the future going to be for my child. Are they going to end up in jail? Because how do I know that they're not going to become really agitated and aggressive, you know, in any kind of random setting, especially as an adult, and I have no control over that. And you know, I'll admit it is very scary, and so that's part of why they need to be in therapy, applied behavior analysis, and individual therapy if possible, if they're able to participate well enough in that, and likely also be on medications to help with the emotional regulation, because the aggression needs to get under control, not just so that they don't something terrible doesn't end up happening to them, like them ending up in jail, but also because their entire life is affected by that. I mean, obviously, if they're being aggressive or agitated and multiple environments frequently, obviously they're going to be rejected by peers, isolated, not being able to participate in school, may not ever be able to go to college, even if they were completely intellectually able to, you know, to achieve that. So it's important to get their irritability and aggression under control. And I will, towards the end of this talk just a little bit about medications, because I want you to know that there are some answers, there are some things that can truly help. So the other thing is self-injurious behavior. You know, sometimes kids, regardless of how intelligent they are, may do things like bang their head when they're frustrated, or bite themselves or something like that. And of course, it's, you know, very stressful and traumatizing for parents to go through. And obviously, it is for the child as well. So there are medicines that can help and therapies that can help to reduce that. And of course, it's also a sign that the child is probably really stressed. And so anything that we can do to alleviate that stress would be helpful. So in terms of aggression and self-harm behavior, it's really important that you understand the basics, which many of you probably do if you have a child. But understand just the basics of ABA therapy to help look for triggers, you know. So like, you know, what they call the ABC sandwich, where antecedents, antecedents is the A part of the ABC sandwich, and then the B is behavior, and C is consequences. So antecedents, they're triggers for the aggression or self-injurious behavior, and the behavior is the way your child responds to whatever that trigger is or the antecedent. And then the consequences are pretty much the rewards, what your child gets out of behaving aggressively. So you really have to pay attention to those things. What are the triggers for the aggression? What are the triggers for the behavior? Am I accidentally reinforcing the behavior because of the way that I'm acting? Am I giving it too much attention? You know, it is what they're seeking attention, and so maybe I need to ignore it. Or are they trying to escape something? And are they trying to escape something because it's too difficult for them? You really have to pay attention to those sorts of things. And a lot of you are probably already becoming adept at figuring those things out just naturally. So when your child has an aggressive outburst, and I cannot stress this enough, when your child has an aggressive outburst, the very first thing that you have got to do is stay calm. Because if you get angry, then all it's going to do is make everything worse, because they already have too many emotions to process, and then they're going to be processing your emotions on top of it, and it just usually compounds the issue. So someone said, my son is autistic but doesn't express pain. He's high functioning, but if he accidentally hits his toe or any body part, he won't express the hurt. Can you explain why this happens? So, you know, that kind of goes along with what we're talking about actually still, because those on the autism spectrum, you have to think about, you know, even though it's considered a mental health issue, it really is a neurological issue. They're not able to perceive the sensation as they should. So if you look at it like a neurological issue rather than a mental health issue, which I do, I think it will make more sense. So it's almost like the parts of their brain that are connected to the pain impulse is different, or not I don't want to say correctly because that's not true, but differently connected, to the point that they may not notice pain. Now, certainly this can be an advantage in some cases, but it can also really be not an advantage. So it's the same reason why your child may cover their ears when there's a loud noise. There are things that they're oversensitive to and undersensitive to, and that has to do with all of the senses. Taste, smell, sight, touch, feel, all those things. They're in sight, although that's less of an issue typically. But basically, that's the reason why your child doesn't feel pain. Now, those things change over time. There are many times where the sensory issues kind of start to wane over time, or maybe kind of fluctuate. I don't know if you all have the same experience, but I know even with my daughter, she her sensory issues and how she perceives them has changed over time in different ways. Sometimes she craves loud noises, and other times she avoids them completely. But everyone's variable on that. Again, it's like someone else had pointed out that their child was undersensitive. So they're all different, but they all have the same problem, which is part of autism, and that's being under or oversensitive to the sensations that are entering their mind. So as far as and that may also actually play a role in self-injurious behavior. It's hard to really know that for sure. Maybe they're injuring themselves because they want to feel something. Of course, it may just be because that, just like typical people that might cut themselves, which is not good. They may cut themselves to feel something physical rather than the mental pain that they're having. That may also be what children with autism spectrum, but I have a feeling it also has to do with some of the sensory integration issues that they have. And most people on the autism spectrum do have that problem. So if someone is aggressive, number one, please stay calm. The second thing is limit what you say. And that means don't start lecturing them when they're like way up here and they're like almost in a panic attack, severe anxiety, severe anger. Limit what you say and make it really short if you have to say anything, like sit down or have a seat or look at this book. Don't make it very short, very brief, because they're having such a hard time processing everything that's going around them that the more you add to it, it's just going to make things worse. And probably most of you have noticed by now that pretty much you can't talk them out of a tantrum. Once they're already at their peak, it's done, it's over. All you can do is wait for it to stop. And the more input you put into it by talking to them or asking them questions, it generally just prolongs it and makes it worse. They have to learn to calm down and self-soothe. And this is including teenagers. They have to learn how to calm down and self-soothe. And that may be going to the bedroom and calming down on their own. And it's a good idea to have that conversation. So the next thing is move your child to a safer place. So if they're agitated and upset, angry, move your child to a safer place where they can't throw things that can harm you or anyone else, or they can't hurt themselves, they can't knock over a bookshelf on themselves or something like that. If you ever get to the point where you need to physically restrain the child, then you need to make sure that you have an ABA therapist, an applied behavioral technician, or board certified behavioral analyst to help you through that. Because number one, you don't want to inadvertently hurt your child, even though you meant no harm. And when it gets to that level, you really need a behavioral expert in there as well to kind of help guide you through that. The other thing that I wanted to talk about is depression and anxiety, because there's no way we can really have an adequate conversation about teenage years and puberty without talking about depression and anxiety. As I said earlier, it may be that your child has a breakup with his or her boyfriend or girlfriend, and that's devastating. But those on the autism spectrum definitely have an increased risk of depression and anxiety, unfortunately. And I hate to tell you that if you didn't know that, because I know no one wants to think about their child having any more struggles or difficulties. fortunately or unfortunately, depending upon your child and where you're at, usually those people that have depression are more likely those that are more cognitively aware of their differences, and want to be around peers, but are having a hard time trying to make friends. So the positive of that is obvious, that they have the need and the want to, and that may, in the long run, make them happier, if you want to look at it that way. But it also is very difficult for them to manage all those feelings, because they have more insight into what they could have and what they don't have, and that can kind of be a setup for depression, and anxiety, including social anxiety. So social anxiety and depression are two things you really have to monitor, and I have to monitor in patients that I see that are in their teenage years, that have autism. And unfortunately, even though I know it also is an uncomfortable topic, suicidal thoughts are a real thing. Suicide attempts are a real thing. We can't really ignore it. And over the last 5 years, there's been growing evidence, unfortunately, that those on the autism spectrum may have a higher risk of suicide, because of all the difficulties they have to go through. And it appears that it's more likely those that are what we call higher functioning, which I know nobody likes that term, but I prefer more aware of their situation and their surroundings, have more insight into what's going on. Those people are at a greater risk of suicidal thoughts and behavior. And by behavior, I mean self-harming, not in the same way that a young child with autism self-harms because they're frustrated, but it's self-harming to get rid of emotional pain or depression. So it's important that if you feel like your child is even more withdrawn than their normal self, and they are maybe more irritable, seem more sad, having more crying episodes, maybe they did have some friends and now they don't, or they're staying in the room almost all the time rather than just sometimes, that you do consider getting help for your child, or at least getting them checked out by a therapist or a psychiatrist. The symptoms of depression are depressed mood, irritability, insomnia or hypersomnia, meaning sleeping too much or sleeping too little. The other thing is loss of interest in activities that they used to like to do. They may have excessive guilt or feel hopeless. They may have a much lower energy level, maybe kind of more sluggish than they normally are. Their appetite may be too high or too low. And then, of course, having suicidal thoughts, that obviously is also a symptom of depression that we have to be careful about and monitor. And those children and teenagers that have social anxiety, which definitely social anxiety especially presents itself by teenagehood, you really want to be careful with the social anxiety, because they already have a hard time interacting with other people and they already miss social cues. And so socialization is already difficult. So if you add social anxiety on top of it, which makes them feel more uncomfortable, then they can really start to decompensate. It's like having a double whammy. So now you want to have a friend, but you can't because you can't quite connect with them or understand them. And now, secondly, you're anxious and you avoid them. So it makes it really tough, and it will almost exacerbate the autism symptoms if the social anxiety is not treated with therapy or medications. Again, the link between suicide and autism is just recently starting to be looked at over the last 5 years. But it does look like, in preliminary studies that are small, so it's not a fact exactly, but it appears that they're 9 to 10 times more likely to attempt or commit suicide. So, unfortunately, that's not a small number. So we really have to love our children and pay attention to them, even in their teenage years. Maybe we thought they were out of the woods and they were safe and everything, but we have to continue to be vigilant and be careful about what's going on and how they're doing. Let's see. As far as medications go, and again, anyone can please feel free to ask questions at this time, but I want to talk about medications. There are some of you out there that are deathly afraid of using medications, and then there are some of you that are happy to use medications, and some kind of in between that maybe they're reluctant to, but they will kind of if they have to. So usually it runs the whole gamut. But I really enjoy talking with parents to explain medications to them, because usually they have a lot of misperceptions and conceptions about medication and what they can do, and the dangers of what can happen. Um, let's see. So someone asked a question: can a child on the more severe end of the spectrum also become depressed without really knowing why? So the answer is yes, actually, they can. The difficult thing, though, and I'm sure this is what you're thinking too, is that it's difficult sometimes to tell that they are depressed, since they may not be able to verbalize it. It can be very difficult to really know for sure that they're depressed. So you have to really look at the signs compared to their normal selves. So that's being much more withdrawn. Like maybe they used to kind of play and chat or make noises near you, and now they're just like in their room all the time and just laying on the bed all the time. That kind of thing. That would worry me that they're more depressed. So being more withdrawn, less energy, huge changes in appetite and sleep, those things would make me nervous. And I know it's strange that, again, that they could be depressed and maybe not know why. That does happen, and that happens to even typical adults and teenagers. A lot of times they will tell you that they don't even know why they're depressed. And that kind of makes it seem more obvious that it's a chemical thing that needs to be addressed. Although we don't look at depression as to whether or not it's chemical or not anymore. We don't really discuss it like that. In other words, like, do I have a reason to be depressed? Well, the problem is you could argue that any human being may not be depressed under the same circumstances as another particular human being is depressed under. So we try to steer clear of like the reasoning, but basically, yes, you can be depressed and not know why. But again, it's really important to kind of keep an eye on your teenagers and look for the subtle signs. And the less verbal they are, the more difficult I know that that's going to be. But it's still important. And for that matter, even if they are highly verbal, that still doesn't mean that they're going to tell you what's really going on. Even typical teenagers often won't tell you anything about how they're feeling and what's going on. So that's important to know too. We're kind of all in that boat, really, no matter if your child is on the spectrum or not. I do think, and I didn't really mention this very much, but I do think that there's a reasonable amount of irritability that can be expected associated with going to teenagehood, and a little bit of rebellion, a little bit of talking back, and more than normal, and being more opinionated, maybe a better way of saying it. There's going to be some of that for sure, but it's a matter of degree. Is it almost intolerable? And then you might need to start worrying, okay, are they getting depressed? It's even possible for teenagers to be depressed along with those other symptoms I told you, but not actually appear to have a depressed mood. They may just come across as much more irritable. And then like a low energy level and change in appetite and sleep and some of these other things. But going back to the medicines a little bit, if your child has self-injurious behavior or a lot of aggression, especially that comes up in the teenage years, please, please, please do not be afraid to at least reach out for help, to see a psychiatrist about what might be done. You don't have to do it. So like, for example, let's say that your child is having aggression or self-injurious behavior, or hitting their parents, hitting their siblings, or even hitting a teacher. I hope not, but even hitting a teacher, obviously it happens. Please don't be afraid to at least get them assessed by a psychiatrist. It does not necessarily mean they're going to start medication. Obviously, you need to be enrolled in behavior therapy at that point, if not, haven't already been in therapy for a while, for ABA therapy. But please don't be afraid to at least inquire about medications that can help, because sometimes it can almost be miraculous how much those medications can help in some individuals. And those medicines that I mean are Risperdal, which is risperidone, is the generic, or Abilify, which is the brand name, and aripiprazole is the generic. Those medications are FDA approved for autism spectrum disorder for aggression and self-injurious behavior and severe tantrums, and they can make a world of a difference. However, they do come with some side effects, which I'll be happy to discuss in just a second. But it's important for you to know that they are available. And in some ways, the older they get, the less side effects they can have from those medications. So, but you deserve to know the pros and the cons of that medication and be able to weigh that yourself as a parent. But to not even know the information is what scares me, because a lot of times parents don't even know. So, for example, if your child is having significant aggression or agitation, they could use risperidone or Risperdal, or Abilify or aripiprazole. Those are the same things. And they could substantially decrease. Obviously, everybody's different, but I mean, you may go from having a severe tantrum daily or every a couple times a day to maybe once a week or once a month, and that's a big difference. I mean, you're not going to completely get rid of it probably, but you're going to put the irritability and tantrums and agitation at much more manageable levels, so that they can have a much better quality of life, whether that's in school or with friends or with parents or whatever the situation is. They may be able to leave the house a lot more, whereas before maybe they weren't able to. Now, the cost that can come with is those medications of Abilify and Risperdal can increase, not will, but can increase blood sugar and cholesterol. So you usually have to get blood drawn every 6 months to a year just to make sure that their cholesterol and blood sugar isn't going up. And it's rare that it's a dramatic increase in any of those things. So it's like a slow, steady increase sometimes. So it's not to minimize that risk. It's that usually those are more long-term side effects, and probably not worth worrying about if you're dealing with really severe aggression. And there are some other side effects that go along with it that some people worry about, like gynecomastia, which is males growing breasts. I want to dispel this myth. That is true. That is an actual side effect, but it is very, very rare. And in most cases where a child has gynecomastia, most of the time, that gynecomastia might have happened anyway, because it can happen as a normal part of puberty that needs to be addressed. So I don't think that it's a smart idea for people to avoid that medicine altogether. Although if you're really nervous about it, then you could just try Abilify instead of Risperdal, because it really doesn't have that same risk of gynecomastia. So there are ways of getting around these things, which again, you could talk with the doctor about. All you have to do is just be honest about what your real concerns are. Don't just say, oh, we're not interested, but without saying what you're really scared about. Because I know they used to play in my area, and probably in your area, commercials about gynecomastia and lawyers wanting to sue companies for that all the time. So a lot of parents will come to me and say, okay, but I don't want Risperdal for that reason. So the other thing is, there are other medicines other than Risperdal and Abilify in that same category that we use off-label if someone has too much weight gain or there are other side effects that they don't like. There are other ones that you can use, like Geodon or Seroquel. There's Vraylar and Rexulti. I feel like I'm leaving some out. There's Latuda, and there are some other medications that you can use as well. There are options. There are options to think about. Of course, nobody wants to put their child on medication unless they have to, and that's fine. But you just need to know what the options are. And then the other thing is for depression and anxiety. Obviously, we treat depression and anxiety in those with autism the same way that we treat typical children with depression and anxiety, and that's with antidepressants. So if you're familiar with Prozac or Lexapro or Zoloft, those are the ones we commonly use to treat depression and anxiety if your child has those in a severe way. Of course, those things don't replace therapy. You should have your child in therapy as well, but it's important to not be afraid of medications. Ask tons of questions. You can even refuse to give the medication, but as long as you're well educated and you understand why the medicine is being recommended. I think that's really the most important thing. That's most of what I really had. I was also wanted to just touch on the fact that it's like this is the audience where I'm kind of preaching to the choir, but it's important to know that even though you love your children more than anything in the world, it's also important to know that parenting stress is really, really tough. And parenting a child with autism, no matter what age they are. And research has actually proven that more than parents of parenting a child of any other special need, whether that includes a physical disability, whether that includes Down syndrome or learning disorder, or ADHD, autism by far is the most stressful. And there are lots of reasons for that. But I think the majority is when your child has a lot of irritability or tantrums or aggression. Those specific characteristics can be completely overwhelming to deal with on a daily basis. And if your child has a lot of aggression, I think it's important to know that it's okay to realize that you might need help too in dealing with your own mental health, because dealing with a child with severe aggression and agitation takes its toll. It almost causes PTSD kind of symptoms where you're always on alert, always on guard, because your child's behavior is so unpredictable. So don't forget to get help for yourself if you need it. At least get a therapist or a counselor to be able to talk to that may understand some of what you're going through. And the last thing that I want to talk about is, and then of course, if there are any questions, of course, feel free to pop them up. But the last thing I want to talk about is elopement. Elopement is oftentimes thought about as something that happens more often in young children, but teenagers elope too. An elopement means to run off. And oftentimes there's a trigger, but sometimes not one that you can be aware of. Maybe they got stressed, or they're trying to escape a situation, or maybe they're going towards something like a circumscribed interest, something that they're like really, quote, obsessed with, although it's not a true obsession, but that they have a strong interest in. Like I've had some people that they really loved dogs a lot, so they would just like leave home and just wander around the neighborhoods just looking for dogs without telling anyone. Other times it's a little more purposeful than that. They're running away and they're almost hiding, or they think they're going somewhere that really they haven't really planned out, and they just keep walking. So please be aware that you protect your child in that way, whether it's by having a GPS system or device on them. Some sheriff's office, some will give those to you for free, like a special watch or something that's really a GPS monitor. Obviously, doing other things that you can, like having a house alarm, so that at least you'll know when someone leaves. You could, have a double bolt deadlock, so that they cannot get out without a key. Obviously, there are fire safety hazards and other things like that. But if you have a child that's eloping frequently, that might be worth the risk. You have to kind of play that out. But the important thing is just to realize that elopement is a real thing, and it can happen, and you can't let your guard down and think that there's no way that that's going to happen in their teenage years, because it does. Most of the time, the parents also spend a lot of time worrying about what's going to happen when their child's an adult. And I do think that you have to kind of pre-plan that a little bit, maybe hope for the best, but plan for the worst, so that you're kind of prepared, so that if your child's going to be living with you indefinitely, you know how to plan for that. Or if your child isn't going to be able to go to college, or they're not going to be able to do the things that maybe you had hoped that they might be able to do, that you plan other goals and other ways of moving through that. So the teenage years are not just hard for the child, it's hard for the parent, because usually in the teenage years you start to come to a lot of realizations as far as what your child may or may not be capable of. Although some hope is that there's proof that children even improve in their 20s, and in a lot of ways, even executive functioning. So there's reason to be hopeful. So don't think that just because your 15-year-old is acting a certain way that's not going to improve, because hopefully it is. Whatever issue that you're having is going to continue to improve. So I also wanted to share with you a book that I wrote briefly. It's, hopefully you can see it. It's called Caring for Autism, Practical Advice from a Parent and a Physician. And I wrote it specifically because I got tired of parents having to feel like they have to reinvent the wheel every single time, in the community and with the resources. I myself really had almost no idea what to do when my daughter was diagnosed. And of course, I was actually in residency, so I didn't know tons about autism at that time, but I really had almost no clue about where to start, what to do, and no one really helped guide me, including professionals. Nobody really knew what to do or really knew how best to help. So that's why I wrote the book, is to hopefully help people to feel like they don't have to reinvent the wheel and start all over. Of course, we have this great website, this great Facebook page and stuff to help as well that we didn't have like when my daughter was young. So there are a lot more resources, which I'm really grateful for. But the important thing is just to know that there are resources out there that you can kind of connect with. And my particular book is like a holistic book from everything from what causes autism to the educational system, legal issues like guardianship, medications, what therapies you should use, even religious issues, because those things come up as well. So kind of a wide range of issues. It's kind of like, in my opinion, kind of all you need to know. And it's on Amazon.com. You can order it. Does anyone have any other, I guess, specific questions? I hope I didn't miss any, because I was having a hard time looking at my phone at the same time. So happy to answer questions even. So does anyone have any other questions? If you can repost those so that I can see them if you have any, including any concerns about medications or anything else. While I'm waiting to see if anyone does, kind of pick up, I know that there's a lot of talk about alternative and complementary treatments, what we used to call CAM treatments. Those, there are several things like probiotics and vitamins and stuff like that. In general, those things are perfectly harmless, perfectly safe. Fish oil, perfectly safe, shouldn't be an issue. Those things may help. There's not a lot of evidence either way, but those things are okay to use. There are other things that are not definitely not regulated, or there haven't been a lot of research on. So obviously not just because I'm biased, but because I'm also a parent. But please don't get taken don't let anyone take your money promising cures or anything like that, because there isn't a cure or anything like that. And of course, I know a lot of you also probably would have the same opinion that you don't really want a cure. You want your child to still be the same. You just may want to deal with some of the behaviors that are a problem a little bit better, like especially tantrums and aggression and stuff like that. So if there aren't any other questions, thank you for allowing me to talk and to be here. I'll be happy to come back anytime if anyone wants to discuss any particular topic. Have a good day.